It's opposite to myopia. Now the synonyms for hypermetropia are hyperopia or long-sightedness. We know that the rays get focused behind the retina, and just similar to myopia, here also we have three types: axial, curvature and index hypermetropia. Okay, now let's look at axial. You can compare it with that of axial myopia. Here the eyeball will be smaller, right? And the normal length is 24 millimeters, and here in hypermetropia, the eyeball length is less than 24 millimeters. Hence, with even the normal power of convergence of the cornea and the lens, it is going to focus behind the retina because the eyeball is shorter. As opposed to the longer eyeball in myopia, here the eyeball is short, so the rays go behind and focus. And same thing over here, 1 mm shortening of the eyeball causes 3 diopters of hypermetropia. Okay, so now the eyeball is short, so the rays can no longer focus on the retina. They're focused behind the retina. Now an important question: what is the refractive index of a newborn child? Okay, we know that babies are born with small eyes, so obviously they will be hypermetropic because the length of the eyeball is shorter, right? So, however, what is the refractive error which you are going to term it as normal, and what is the one that you are going to call pathological in children, okay, in babies? We know that the eyeball is small, so all the newborns are hypermetropes. And normally the error at birth is 2 to 3 diopters, plus 2 to plus 3 diopters. This is the natural refractive error. Now pathologically there can be some exceptions, such as on preterm babies the refractive error is unnaturally high and it can go up to as high as plus 10 diopters. Okay, that is because their eyes are not completely developed and they are too small in premature babies, right? So the treatment of hypermetropia is glasses, okay, only for abnormal amounts. In normal amounts we will see why glasses are not given in a little while, right? So these are the hypermetropia glasses. So we have seen the answer for this question is 2 to 3 diopters. The refractive error of a newborn, please memorize this, plus 2 to plus 3 diopters. Now let's look at curvature hypermetropia. Just as we saw in curvature myopia, the cornea was steeper in that is more bent. So you can understand what can happen in hypermetropia. The cornea is flatter, right? Such conditions can be seen in congenital disorders. However, they are very rare. Now the flat cornea is unable to focus the light rays exactly on the retina because of less power. The power of cornea is much less when it is flatter, right? So that causes focusing of the light rays behind the retina. So because it is flat, it can no longer focus the light rays on the retina. That is the pathogenesis behind curvature myopia, hypermetropia. Now let's look at index hypermetropia. What happens here is that there is a change in the refractive error, refractive index of the eye, that is, it will decrease. So whenever there is a reduction in refractive index, there is reduction in bending of the rays. As less as 0.2, whenever the refractive index reduces just by 0.2 also, it can result in index hypermetropia. So there is reduced bending of the light rays and then they go and focus behind the retina. This is the pathogenesis of index hypermetropia. The refractive index of the eye is decreasing. Okay. Now an interesting thing you have to see here is the difference between the vision of normal people and hypermetropes. See, there is no difference at all. Why is this? They both look the same. This is because the crystalline lens accommodates both the near and the distance rays. This is the problem with hypermetropes, that they accommodate for a very high powers as well. So they have very clear vision even though they are high hypermetropes. Usually they have normal vision because of the accommodation by the lens. Why are hypermetropes called long-sighted people? You have to understand here that neither the rays from far nor the short distance will focus on the retina in hypermetropes. None of the rays are focusing. However, when the rays are coming from long distance, the lens will try to accommodate so they can see the objects that are located far away just because of accommodation by the lens, not because the rays are focusing. See, here also the rays are not focusing on the retina from long distance. Same in short distance, they are already divergent and the accommodation of the lens is not sufficient. So, they have a difficulty with their near vision. However, the distance vision, with the help of accommodation, they are able to see properly. Because the lens can accommodate up to 16 diopters. That's a very high power. Okay. The same thing here you can understand. See, in distance vision, the lens is trying to accommodate. So, we know that in accommodation triad, there is convergence as well. So, whenever the lens accommodates, by synkinesis, there is convergence of the eyeballs resulting in a convergent squint or esotropia. Now, how will you treat this condition? Very simple, you just give the patient a pair of glasses, correcting his hypermetropic error, and see. The eye becomes absolutely straight and normal. The ESO deviation is gone. That is the treatment of convergent squint in hypermetropia. Now, what happens in myopia? They result in an exotropia. See, there is an outward deviation because the myopes cannot accommodate as well as the hypermetropes do. So, they have a poor ciliary muscle tone. Okay. In hypermetropia, because it's accommodating too much, the ciliary muscles are very strong, but there is no accommodation in myopia, so the muscles are weak and hence they result in a divergent squint. Okay. So, they result in a divergent squint. See, the eyeball is moving outwards. Okay. Now, correction we have seen, we will give a pair of convex lenses to increase the power, because in hypermetropia the power of the eye is less, so it is unable to focus the light rays on the retina. So, if you give a convex lens, it will help in focusing the light rays. So, just similar to that of myopia, but a little bit different. There occurs 2% magnification as opposed to the minification in a concave lens. Convex lens causes 2% magnification of the image for every 1 diopter. So, if you give plus 10, there will be 20% magnification of the image, and the gesture is like this. They push the specs away onto the tip of the nose for a better vision, right? Now, let's have a quick comparison between myopia and hypermetropia. Right? In myopia, rays focus in front of the retina and hyperopia behind the retina. Myopia cannot see distant vision. Hypermetropia, their complaint will be asthenopia. Right? Now, that is corrected by concave lenses, myopia, and hyperopia will give convex lenses. And the patient, the gesture will be they move the glasses close to the eyes, and hypermetropia will move the glasses away from the eyes, and these glasses cause minification in myopia, and in convex lenses they cause magnification. We have also seen that the accommodation is poor in myopia and very good in hypermetropia. That's very strong. And the squint type is divergent in myopia and convergent in hypermetropia. Okay. Together, myopia and hypermetropia are called spherical errors. Why are they called spherical errors? Because you are giving spherical lenses, that is a convex or a concave lens, both are spherical lenses, right? So, the prescription you will have to write S, that indicates sphere, and a negative sign for myopes and positive sign for hypermetropes. So, myopia you will say -2 diopter sphere for the correction of the prescription, and in hypermetropia I will say +2 diopters of sphere.
Hello everyone, this is Dr. Sai Suguna, your mentor for ophthalmology at Medicoapps. Now, thanks for watching the video. Now we have put such videos all together in our ophthalmology app. The trial version you can download from the link over here or in the description box below.